wax, so it's very glutinous consistency, and there was a lot of matted hair as well embedded into this wax, which both of those conditions make the wax a bit more tricky to remove. When you've got sticky wax like this, it's very hard to use suction, and that's because the sticky wax, it clogs up the tube, you don't really get a suction grip. And furthermore, when you've got hairs matted, you're less able to obtain a suction grip. So what I've immediately done, I've instilled some olive oil spray into the ear. So it's not cooking grade olive oil. This is medical grade olive oil that we use. So it's sterilised for safe use in the ear. And I prefer a spray because with the spray, it's an even coatings and even mist in the ear, as opposed to the drops. Sometimes you can get some really with drops, you can get big lumps and drops of oil, and it doesn't evenly distribute itself within the ear canal. So what I'm trying to do here is just detach this plug of sticky wax from the bottom of the ear canal. You can see there I've able to lift it up, and we're near the entrance. Although this wax plug, if you keep watching, you'll see it's a really big plug of wax here that we remove. But I'm actually removing it just from the entrance. So I'm getting a suction grip now from the wax, from the surface of the wax. And we know we're near the entrance. You can see all these hairs to the left. So these hairs are located on the first bend. You don't get any hairs, or you shouldn't get any hairs that are growing, at least, from the root, from the follicles in the inner 2/3 in the ear, so the bony part, because there's no hair follicles on the bony part of the ear canal. The hair follicles are only located on the outer third, the cartilaginous portion. You can see I've managed to detach that. I'm just trying to wriggle it forwards now out of the ear. So we're just we're extracting it outwards now. But because it's sticky, it still sticks to the hairs and to the ear canal. And quite often we get asked, why don't we trim the hairs now? Occasionally, you may have seen a few of my videos recently, I've had to pluck the hairs out to the ear. There were so many hairs in the ear that there was complete obstruction. I couldn't see the eardrum. So I used some forceps to pluck it. The reason why we don't trim the hairs in this case is because it's not really causing me a massive inconvenience, and the hair's only going to grow back. And they're going to go back quicker than the wax forming back. So there's no added benefit there. So I've just used an ear hook because it was trapped at the entrance. I rotated the hook clockwise, so the tip got embedded at the top of the plug of wax into the core, and I slowly brought it forwards. So I've just gone back in with the suction probe, just trying to wriggle this a bit further out the ear again. You can see some dead skin there. So I've just gone back in with some olive oil spray. And the spray is really good. It changes the consistency of the wax, it binds it together, it lubricates not only the ear canal wall, but the inner part of the suction tube. So if you do get any wax that's clogged in there, hopefully it will automatically declog by itself. Now, sometimes if the suction tube does get blocked, so these suction tubes that we use there, they're single use, they're sterile. I think that was a question I was previously asked. And so they're sterile packed, and within the sterile pack, there's a cleaning rod. So if the tube does get blocked with wax, I can just insert the cleaning rod, thread it through and unblock it. So I'm just going back in with the hook here, just bringing it forwards a bit. So although the hook didn't remove the plug of wax, it's just loosened it a bit for me. So I can now return with the suction probe. You can see it's wriggling out much easier. And this is the long piece extending all the way to the eardrum. You can see all those hairs. Now, the patient did have really hairy ears. I'll come back to it in a moment. So that's the patient's eardrum. It's nice and healthy. But you may have noticed the steep incline of this patient's ear canal. So it's slightly abnormal in that respect. Everyone's ears do have an inclination, so an upwards trajectory of around 30 degrees, but I say this patient's about 45 degrees. Is that causing them any problems? I wouldn't have thought so, I don't think, unless sometimes you can get an inclination of the ear canal like this patient, but there's a valley, so there's a V-shaped as it's going up, so it's a little crater there, a little trench, and you can get wax or skin trapped there, but in this case there's not. The left side came up much easier. So this is the more lateral plug. Now there is a matted plug right up against the eardrum, so I'm just going to go in and get that out. Yes, this patient's got really hairy ears and they do trim their ear hairs, and I've just advised the patient to position some cotton wool just at the entrance, not in the ear per se, it's just to seal the entrance, trim the hairs so they don't fly into the ear canal, and then remove the cotton wool ball. So that's the second plug. If you stay tuned, you'll have some really close-up shots of these wax plugs. Again, it's a massive, really steep trajectory there of the ear canal, and then near the ear drum itself, the ear canal dips. We call that the inferior recess. So that's the plug I removed from the right side. This is the one from the left. In a minute, you'll see, I think this is from the left side, sorry, the first two are from the right. And they're all the plugs together. As you can see, the two darker plugs at 12 o'clock and 6 o'clock, they mean that the wax was longer in the ear. So they were the deeper plugs of wax. So there was one from each ear. And the more lighter shade, the kind of more orangey browny colour, that wax plugs were near the entrance, more lateral, so it's fresher wax. Well, I hope you enjoyed that video, guys. Take care.